Syllabus for Dispincer course duration. 1-year paper, a section. Pharmacy and Pharmacology 1. Definition of drugs, nomenclature of drugs, sources of drugs, dosage and preparations, pharmacopoeias. 2. Incompatibilities. 3. Weights and measures metric and imperial systems with symbols and their conversions. 4. Compounding and dispensing of pharmaceutical preparations. 5. Calculations of percentage solution. 6. Reading and writing of prescriptions, including knowledge of parts of prescription with criticism, Latin names and signs of everyday use. 7. Basic knowledge of important commonly used drugs, which will include the following: A. Classification. B. Names of official drugs. C. Preparations, doses and routes of administration. D. Important uses, contraindications, main toxic effects. 8. Drug Act. 9. Medical Dental Ordinance. 10. Prohibition of Medical Practice Ordinance. 11. Duties and responsibilities of dispenser. Section 2A Basic concepts of following systems of human body. 1. Digestive system. 2. Circulatory system. 3. Respiratory system. 4. Nervous system. 5. Excretory system. 6. Reproductive system. 7. Skeletal system. 8. Lymphatic system. B. Record keeping and maintenance of following registers. 1. Charting temperature, pulse, etc. 2. Outdoor register. 3. Abstract register. 4. Poisons register. 5. Expense register. 6. Medical legal register. 7. Postmortem register paper. B section, I1. Drugs acting on autonomic nervous system. ANSA. Basic concepts of ANS. B. Adrenaline, dopamine, salbutamol, ephedrine, beta blockers and methyldopa. 2. Drugs used in glaucoma. 3. Drugs used in angina. 4. Drugs used in hypertension. 5. Drugs acting on respiratory system. A. Expectorants. B. Antitussives. C. Bronchodilators. 6. Antibiotics and chemotherapeutic agents. Sulfonamides, cotrimoxazole, penicillins, cephalosporins, aminoglycosides, tetracyclines. Chloramphenicol, macrolide, antifungal drugs, antiviral drugs. 7. Drugs used in the treatment of tuberculosis, leprosy, amoebiasis, malaria and anthelmintics. 8. Hormones. A. Oxytocin, ergometrin, oxytocin. B. Hypoglycemic drugs. Insulin, oral hypoglycemic, corticosteroids. 9. Drugs acting on blood hematinics, anticoagulants, heparin. 10. Locally acting drugs. Demulcents, emollients, dusting powders, bitters, volatile oils, digestive ferments. Antiseptics. 11. Drugs acting on gastrointestinal tract. Antacids, purgatives, antiemetics, drugs used in peptic ulcer, antidiarrheal drugs. 12. Drugs acting on central nervous system. Antipsychotic drugs. Major tranquilizers, anti-anxiety drugs. Minor tranquilizers, narcotic analgesics, antipyretics. Non-steroidal anti-inflammatory drugs, alcohol, hypnotics, general anesthetics, local anesthetics and analeptics. Nicothamide. 13. Treatment of overdosage and poisoning. Morphine, opioids, atropine. Strychnine, insecticides, kerosene oil, acids, caustics, alkalis, toxicology, side effects of drugs used. 14. Basic concepts and first aid management of following diseases: AIDS, hepatitis, diarrhea, typhoid, cholera, poliomyelitis, TB, tetanus, whooping cough, measles, mumps, diphtheria, epilepsy, asthma, rabies, snakebite. Immunity. Section 2.1. Sterilization. Principles of sterilization as applied to operation theater, dressings, hands and skin, preparation of hypodermic injections, syringes. 2. Artificial respiration. 3. Basic concepts and first aid treatments of burns, fractures, heat stroke, dehydration. 4. Practical training in emergency procedures and anesthesia. 5. Charting of temperature and pulse. 6. Pattern of treatment chart, investigation forms. 7. Use of common clinical appliances: thermometer, BP apparatus, sterilizer, lumbar puncture needle, splints, etc. 8. Virus, bacteria, fungus. 9. Elementary knowledge of sera, vaccines, toxins and antitoxins, i.e. anti-tetanus toxoid, anti-diphtheria toxoid, anti-rabic vaccine, anti-snake venom, anti-gas gangrene serum, and vaccines for cholera, typhoid, whooping cough, influenza, poliomyelitis, typhus, plague, TB, measles, etc. 10. Storage of drugs, vaccines, transportation, their validity, stock taking and labeling. 11. Routine urine, blood and sputum examination and other routine examinations and normal values. Sample collecting for laboratory tests and their proper disposal. 12. Blood grouping and blood transfusion. 13. Basic knowledge of expanded program of immunization EPI. Healthcare system. Introduction, environmental protection. 14. Diarrheal diseases and their control, oral rehydration therapy. Vaccine chain. 15. Storage of equipment. Bedding and clothing, surgical instruments and rubber goods. 16. Shock definition, types and first aid management. 17. Preparation of emergency room. Minor surgical procedures in following conditions: hernia, hydrocele, lipoma, fibroma, episiotomy, lumbar puncture. Practicals candidates will be required to prepare and dispense following preparations. 1. Preparations A. Ointment of sulfur and other skin ointments. B. Solutions: potassium permanganate, acroflavin, dextrose saline solutions. C. Fractional powder. D. Menthol's paint. E. Gum paint. 2. Appliances. A basic knowledge of simple appliances and their method of use. A. Stethoscope. B. Sphygmomanometer. BP apparatus. C. Sterilizer. D. Enema. Can. E. Lumbar puncture needle. F. Splints. G. Familiar with modern techniques. 3. Identification of specimens. Identification of different shapes of the drugs, e.g. A. Enteric-coated. B. Sugar-coated. C. Different routes for administration of drugs. D. Normal values of different tests. E. Flatus tubes. F. Operation of the oxygen cylinder. G. Use of catheters. H. Identification of different scopes. I. Physical examination of injectables. J. Packing and preparation of drugs. K. Poppy capsules. L. Belladonna root. M. Aspirin powder. N. Sodium bicarbonate. O. Copper sulfate. P. Menthol. Q. Thymol. R. Camphor. S. Tinct cardamom. T. Spirit. U. Gentian violet. B. Acroflavin.